Hello, let's continue our discussion about conditions or disorders in the GI tract. We've already done constipation, so today we're going to discuss irritable bowel syndrome or IBS. IBS is a group of symptoms that affect your digestive system. It is common but uncomfortable gastrointestinal disorder. People experiencing IBS get gas, excessive gas, abdominal pain, and cramps as well. IBS is a type of functional GI disorder, and then the condition is also called disorders of the gut brain interaction. The gut brain interaction, like your stomach and your brain, when they don't interact well, that is when you develop IBS or you have the symptoms. So it has to do with how your gut and brain work together. These problems causes your digestive tract to be very sensitive. It becomes very sensitive. They also change how your bowel muscles contract. So IBS affects your bowel muscles, how they contract. It's usually too sensitive. It becomes too sensitive. The result of the sensitivity of how your bowel muscles contract leads to abdominal pain, diarrhea, and constipation. Like you can see in this picture, it can be very, very uncomfortable. And then it has like there are clusters of IBS. The one with constipation, when you poop, it's usually hard and lumpy. The one with diarrhea, you will have loose and watery stool. And then there is a mix of the ones with diarrhea and constipation. So the same day you might have experienced constipation all day and then you start having diarrhea or vice versa. In people with IBS, the colon muscle tends to contract more than in people without the condition. And these contractions cause cramps and pain. People with IBS also tend to have a lower pain tolerance. They can't tolerate pain at all. Research has also suggested that people with IBS have excess bacteria in the GI tract, which contribute to their symptoms. We all have bacteria in our GI tract for good flora, good flora like bacteria. But in people with IBS, research has shown that they have excess and it contributes to the symptoms. You may hear these names of IBS. Sometimes it's called irritable bowel, irritable colon, spastic colon, nervous stomach, and so on and so forth. When it's all these symptoms often happen when you are feeling emotional stress, tension, and anxiety. So those are some of the triggers. Is some of the triggers. So be mindful about your stress level because whenever you are stressed, it may trigger or flare up your condition. Who is at risk for developing IBS? The condition most often occurs in people in their late teens and early 40s. Women, we women can be twice as likely than men to get IBS. Women are at higher risk than men, and IBS may happen in multiple family members. So you may be at risk or at higher risk if you have family history of IBS, if you experience emotional stress, tension, or anxiety, if you have food intolerance like lactose intolerance or cheese intolerance, a history of physical or sexual abuse can lead to developing IBS. Severe digestive tract infection can also lead to IBS. So if you have IBS, you may have noticed that certain things trigger or bring up flare the symptoms. Common triggers include foods and medications. Some foods and medications can trigger your IBS. Emotional stress can also be a trigger of IBS, like life stresses. So please be mindful about your stress levels. How common is IBS? Is it common? Experts has estimated that about 10 to 15% of the adult population in the United States alone have IBS. But with this between the 10 to 15, only 5 to 7% receive IBS diagnosis because it is a common disease that and gastroenterologists diagnose. So only about 5 to 7% receive an IBS diagnosis. Most people's condition or the disorder is managed with lifestyle changes like food and exercises. Research don't exactly know what causes the IBS, but they think a combination of factors can lead to IBS, including problems with how your GI muscles contract and move food through the GI tracts. Extra sensitive nerves in the GI tract is believed to also cause it. And then brain gut dysfunction, miscommunication between nerves in the brain and the gut is believed to also cause the IBS because research alone hasn't come out with specific cause of the IBS. Somebody might be wondering, how is IBS diagnosed? If you have been having uncomfortable GI symptoms, see your healthcare provider. The first step in diagnosing IBS is a medical history. They will ask you about medical history and a physical assessment. Your provider will ask you about your symptoms. Do you have pain related to bowel movement? When you go to the washroom, do you have pain? Do you do you notice a change in how often you have a bowel movement? Your bowel movement pattern or pattern. Has there been a change in how your poop looks? How often do you have symptoms? Symptoms meaning the cramps, the pain, the discomfort, the bloating, the diarrhea, constipation, those are all of it. When did your symptoms start? They will ask you. So, right, if you're feeling what I'm mentioning, start writing and then pay attention to it. So when you go to the hospital or to see your healthcare provider, you will be able to tell them because it's only you who can tell them the symptoms, how you feeling when it comes and what flares it up. Remember, when it comes to healthcare, you should be an active participant in the care. You can't just go and sit and say, oh, when they ask you a question, I don't know. That is not going to help the healthcare provider come up with come up with a good care plan for you. So you need to know your symptoms and be actively involved. After all, you know your body better than anybody else. They will also ask you what medication do you take because some medications can trigger the symptoms. Have you been sick or had a stressful event in your life recently? Remember, I said stress can also cause the symptoms. So they will ask you all these questions. Sometimes, depending on your symptoms, medical history, and other factors, your provider may recommend a flexible, if it's flexible sigmoidoscopy, or they call it coloscopy, to examine your colon in more detail. So they will do colonoscopy exam. They will put a tube with a long tube with a light to check your colon, see what's going on inside. It's so fascinating when you see it being done. I don't have a picture. Next time I'll bring a picture. When I talk about another GI issue, I'll show you colonoscopy, what it is. So they will do that. They will do that, and then you will see they will see what is going on. They will do it can help when they do that, it helps them evaluate bowel disorders, rectal bleeding, or sometimes polyps will be they will see some polyps in your bladder. Oh, in your gut, sorry, in your guts, and look into your rectum to see your colon. They will also view the lining of the rectum and lower part of your colon. The colonoscopy will they will insert the colonoscope through the rectum, through your bum, remove a small amount of tissue for biopsy if necessary. Sometimes to if they suspect like cancer or something, they will do that and remove a little bit of tissue. It's called biopsy. And then identify and remove small growth. Sometimes the polyps are small growth. If it's necessary, they will remove it. Often, providers can make an accurate diagnosis and even deliver treatments using the colonoscopy. The colonoscopy is a much less invasive procedure. It's not that invasive compared to an abdominal operation. So, when you have all these symptoms and it's bothering you, before they even think of going invasive, like cutting you open, they will do the colonoscopy. Sometimes the colonoscopy alone, depending on the result, your healthcare provider will be able to treat with just the colonoscopy. And before they will do the less invasive procedure that like the colonoscopy before they will think of doing an actual abdominal surgery because that is more risky like any other surgery. They wouldn't want to just put you at risk. Each surgery comes with a risk. So some of the many people find that with these changes symptoms improve, like increase fiber in your diet. When they many people with IBS have realized when they increase fiber in their diets, they eat more fruits, vegetables, grains, and nuts. But somebody who is having, it depends on the symptoms. Somebody who is having diarrhea will not increase fiber in their diets because it's just going to make them go and go. Sometimes they will add supplemental fiber to your diet as well. It's called metamucil. And then drinking plenty of water, like 8 ounce glasses per day. And others will avoid caffeine, like from coffee, chocolates, teas, and sodas. When they avoid all these foods, their symptoms will go down. And then dietary changes like limiting cheese and milk, that is for lactose intolerance. It's more common in people with IBS. Lactose intolerance is more common in people with IBS. So when you limit your cheese and milk, it can help. Make sure to get calcium from other sources. You can get calcium from other sources, not just from milk and cheese. So it's okay to avoid milk and cheese if it causes the flare up. You don't need to go through that discomfort. It's not worth it. You can get you can get calcium sources if that's your issue. You are concerned that if you stop, you are concerned, you have concerns that if you stop eating or consuming cheese and milk, you won't have calcium. You can get calcium from the food you eat, like broccoli, spinach, salmon, or supplements or other sources. You can get the calcium from the food. Okay, so don't be worried that you can have your cheese or milk. Think about your well-being first. It's not worth it to eat, and then afterwards you go through that pain. Sometimes activity changes to like regular exercise, quitting smoking, trying relaxation techniques like meditation, yoga. Eat smaller meals more often. Smaller meals, it's better to eat smaller meals than just sitting down. Smaller meals often than just sitting down and eating a big meal at once. Record the foods you eat so you can figure out which foods trigger IBS flare ups. Flare ups is when you have that discomfort when it starts and it's that unbearable discomfort. Write down what you eat. This will also help when you go and see your healthcare provider because they will ask you maybe what did you eat the night before or 2 nights, 2 days ago. Do you remember what foods you ate? So it's better you write things down. Common triggers are red peppers. Peppers. Some people with IBS, when they eat red peppers, green onions, red wine, wheat, and cow's milk, it can also trigger. These foods are very, very common triggers. Because IBS, the symptoms can cause a whole lot of mood swings. Your provider may prescribe antidepressant medication if you have depression and anxiety along with significant abdominal pain. The abdominal pain can cause severe depression and anxiety because sometimes you can't even function. If you are in such a pain, how do you go to work? It may affect your income. It could affect your income. So depending on the symptoms and how it makes you feel, your healthcare provider will prescribe antidepressants for depression and anxiety, which comes along with the significant abdominal pain. Other medications can help with diarrhea, constipation, or abdominal pain. There is probiotics. Probiotics may be an option for you. Probiotics have live bacteria in it, and it helps. The good ones, the good bacteria can help improve symptoms. Talk to your provider if your symptoms don't improve. You may need more tests. If your symptoms do not improve, talk to your provider because you may need more tests to see if an underlying condition is causing the symptoms. Sometimes the IBS could be a result of an underlying underlying condition. It could be worse than just IBS. So you need to talk to your healthcare provider if medication don't work. Because in some cases symptoms don't respond to medical treatment. Your provider may refer you for mental health therapies. It doesn't mean you are crazy, but it can be emotional. It can lead to emotional stress. Some patients find relief through cognitive behavioral therapy, hypotherapy. So seek help. Don't just suffer in silence, especially if your symptoms are unbearable. See your provider if you have symptoms more than 3 times a month for more than 3 months. And if you have symptoms less often but they interfere with your life, you can't even go to work when it happens. It's good it's a good idea to talk to your provider. Symptoms may point to a more serious problem. It could be like you're even having colon cancer. So you need to speak to somebody, seek help as soon as possible. Seek help or contact your provider as soon as possible. If you have bleeding, fever, weight loss, severe pain, do not just ignore it. You need to. What else should you ask your healthcare provider? when you go. I'm just doing all this because when we go to the hospital, most of the time we don't ask questions. You just go and tell your doctor or your healthcare provider, I'm having pain. I've been having pain in my stomach. Know the questions to ask. If you have IBS symptoms, I've already mentioned the symptoms. These are the questions you need to ask your healthcare provider. Ask this: could another condition be causing my symptoms? What medications can help? These are the questions you need to ask. What foods should I avoid? What other lifestyle changes should I make? Should I make? Can a dietitian help me? Should I see a gastroenterologist, a GI specialist? When will I start to feel better? It's important to know when you're going to start feel better. Am I at risk for other health conditions? These are all the questions you need to ask. It's important. Living with irritable bowel syndrome or IBS can be challenging. IBS symptoms such as stomach pain, diarrhea, gas, and bloating often interfere with your life. But IBS is manageable. You can manage it. It's manageable, though there is no cure. There is no cure for IBS, but it's manageable, though there is no cure. You can improve symptoms through diet and lifestyle changes. If you have stomach symptoms that aren't going away, talk to your healthcare provider. Together, you and your healthcare provider can find an IBS treatment plan that works for you. So let's say some family members can have IBS, but do not share medication. If let's say I have IBS and another person in my family has IBS, both of us need to go and see a healthcare provider because our triggers could be different. So the treatment, what the treatment that might work for me might not work for you. So just because we are family members experiencing the same condition doesn't mean we're going to have the same treatment. So each individual treatment plan is different. So talk to your healthcare provider, even if you are in the same family, and don't share medications. Don't self medicate. I'm going to leave you here. Think about it. I'll come your way again with another GI tract issues because GI tract is we take it for granted because when we eat, the only control we have is putting the food in our mouth. The moment we swallow and we chew, we finish chewing and swallow, what happens in our GI tract? We have no control. It's autonomic. So there are a lot of issues with GI tracts. When you go to the pharmacy shop or pharmaceutical, most of the non-prescription drugs are for GI issues because GI medication because a lot like diarrhea treatment, vomiting, nausea, constipation. It's a huge thing. It's a huge thing. Issues with our GI tract, it's a huge thing. We talk about cancer, diabetes, hypertension, high cholesterol, but we ignore the GI system, but it's very important. It has a relationship with our brain, the gut brain communication. So from now on onwards, pay attention to your GI tract. You may even be having IBS because most of the time it's not diagnosed or your symptoms may be manageable, so you don't pay attention to it. So pay attention to your body. Your body is the biggest laboratory that you can experiment it, and it's free. It's at your disposal. So experiment with your body. Know which foods work better for you and which foods doesn't sit well with your stomach. The page name is Angie Talks on Facebook and Angie Talks One TV. I remain your 21st century virtual nurse and your health and life coach. Follow my page on YouTube. Click on the button so that whenever click on the button and subscribe, so whenever I post videos, you will have access to it. Bye for now. Take care.